everyone. My name is Bianca Stern, Executive Director at the Center for Aging and Brain Health Innovation. I'm really excited today to bring to you a panel focused on age-friendly communities. So as we know, the world around us is a crazy place right now. The impact of COVID-19 pandemic has shone a light on the fragility of older adults, as well as the health systems and communities that support them. In addition to navigating the challenges of this pandemic, we're also dealing with social, political, economic, and environmental upheavals. How are all these factors impacting age-friendly community efforts globally? I'm really excited to have with me today our panel. Dr. Jane Barrett is the Secretary General of the International Federation on Aging, the IFA. The IFA is an international non-government organization with general consultative status with the United Nations and its agencies, including formal relations with the World Health Organization. Jane brings a global, multidisciplinary perspective to our discussion today that traverses public and private sectors. Our second panelist is Myrna Norman. Hi, Myrna. Myrna Norman was diagnosed in 2009 with frontotemporal dementia. At that moment, Myrna decided to become educated in neurocognitive disorders and to become an advocate. Myrna's advocacy is far-reaching as she speaks on the topic with Dementia Advocacy Canada, the Alzheimer's Society Advisory Group, and the Canadian Dementia Learning and Resource Network. Myrna brings her lived experience as advocate and person with dementia to the table today. Our third panelist is Catherine McQuiggan, Chief Officer of the National Age-Friendly Ireland Program, a collaborative national endeavor that is municipality-led and successfully operational across all 31 local authority areas in Ireland. Panelists, thank you for joining me today. So in 2006, the World Health Organization created the age-friendly communities concept and introduced 8 key domains to support active aging and enhance quality of life for people in their own cities and communities during the aging process. Since then, there have been many examples of countries around the world that have taken initiative to create safe and secure environments that foster improvement of health, quality of life, neighborhood social cohesiveness, and allow older adults to remain independent in their homes and communities. Each one of these initiatives have really brought together the strengths of their own communities, their capabilities, their resources, and there are many examples around the world. As noted earlier, COVID-19 highlighted the inequalities that existed across the board as older adults struggled to manage, while at the same time being socially isolated and often cut off from their needed social and health services. And this certainly became more of a challenge with those that were not tech literate. Age-friendly environments and related initiatives are playing a key role in the timely adaptation to and mitigation of the effects of COVID-19. Jane, you've commented to me that the last 2 years have illuminated what is good. Can you explain what you meant by that?
Look, and thank you very much for the invitation to be with you today. I'm delighted. You know, we've got to go back and think about what Age Friendly is all about. And it's about creating an environment that enables older people to do what they have reason to value. And so if we actually take this phrase and then wrap it around, you know, what we've all experienced over the last 2.5 years, you know, what we find is that age-friendly communities has been a vehicle for strategies to guarantee the safe access of medications to older people. It's also really erupted, you know, the digital innovation space. And while we know that, you know, that there's more than 50% of the world is connected, there's a vast piece of the world that's not connected. But age-friendly communities has actually really reached out to that invisible community. Age Friendly has also created the opportunity for intersectoral collaboration and communication strategies, because one of the key areas for this COVID-19 pandemic has been misinformation. And so Age Friendly has really been a common, single, reliable voice. And of course, you've already mentioned it. We've all learned the words of cocoon, lockdown, and what we really mean is people have been isolated and separate from their loved ones and their care workers. So coming into the pandemic, many of the issues of older people were known by us, but COVID has also exposed the opportunities to work together and to build on the foundations of the age-friendly model.
And in certain circumstances, it has also exposed where there are gaps and resources that could be drawn upon. So if one were to take those age-friendly principles and drive them, how might they influence the areas that or gaps that have been exposed?
Look, we only have to look at the percentage of older people that have died through this pandemic to know where we need to start. And when we think about age-friendly cities and communities, it has to be about improving and maintaining the functional ability of an older person. And when I mean function, it's the social, the emotional, the mental, functional ability. And so we really need to actually put a laser focus on those who are most vulnerable, but also use Age Friendly as a health prevention and promotion strategy. What it has shown us also, Bianca, is that governmental investment in health promotion and prevention must be escalated so that healthy aging is at the forefront of pandemic preparedness.
Thank you, Jane. Going from this broader community-based approach to now a little more of the how does it feel being immersed in a community. I'm going to move on to Myrna. And Myrna, I'm going to ask you from your perspective, as you dealt in your daily life with all the important things that you needed to do and wanted to do in your community, where were some of the gaps that you faced, the challenges that you faced from your own lived experience?
That could take a minute. First of all, thank you for having me. I think that there should be a person with lived experience on every panel. I'm really fortunate with my diagnosis because I live with my husband. But things like banking online, I cannot do anymore. Transportation, if I wanted to have a period of time where I had some independence, transportation isn't suitable for me, public transportation. So I felt as though I was stuck in my home. But I have someone to help me. What about all those people who live on their own? They had no access to banks, to grocery stores, but most of all, to a comforting hug, to somebody that cared, because COVID shut all that off. Programs for people with dementia were stopped. Some came back in terms of using computers, but so many of us don't have that capacity any longer, or some never developed the skills. So it was really a devastating time for those of us with dementia and those of us that are aged as well. But what about the people in long-term care homes that had nothing for weeks and months? You know, I think the bottom line is we all so need companionship and bonding with humans. And that's all I think most people are asking for. A city square where we can meet, that kind of thing. Access of old malls, put a coffee shop in there and open it up. There's so much we can do. And I really want to say thank you to Dr. Jane for all the things that are happening around the world. There's marvelous things. We just need to spread it out there. Thanks very much.
Myrna, as an advocate, how have you been involved in planning around services? And where do you find the gaps in that?
I've been involved in a lot of planning. Anytime I can put my name forward as somebody with a voice with dementia, I do that. But one person sitting in a committee room with 12 others doesn't have the same sort of, without becoming cranky, and I don't want to do that all the time, it's really hard to get points across. And I think sometimes that we're trying to reinvent the wheel, when all we need to do is look at the parts of the wheel that are still there and just rework those. I don't think we need to, as I said, reinvent. We just need to use what's there and build it for all of the citizens.
Thank you, Myrna. So build on what we have. Don't reinvent. Catherine, age-friendly communities across the UK and globally are playing a vital role in supporting, involving, and giving voice to older people during COVID-19. In fact, it was Jane that introduced me to you right at the beginning when I said to her, give me an example of a really strong role model, a country that's doing some amazing stuff, and that's how we met. In these communities, residents, local groups, councils, and businesses all work together to identify and make changes to ensure their place fosters the abilities of older people. Older residents are particularly involved in shaping the place that they live. The age-friendly model you lead has demonstrated much success and seen tangible results in the 31 counties across Ireland, serving as a strong role model globally of collaboration that embeds age-friendly principles in all aspects of community. I know every time I meet with you and your team, I learn something new. Can you highlight examples of specific initiatives that have made a big difference in Ireland?
I can, and thank you so much, Bianca, for having me here today. It's always a privilege and an honour to be invited to speak and share learnings, and particularly with Canada, because albeit that we've been rolling the programme out in Ireland for the last 12 years, we still have a lot to learn from other countries, and there are a lot of things that you do in Canada that work really well. But we're delighted with our endeavours over the last 12 years, and I suppose I want to go back to Myrna's point. What's been central to our success is that we haven't done tokenistic things and asked people to come in to hear their voice. We've asked them to come in and co-design and actually roll up their sleeves and tell us what are the challenges and how do we need to address it. But being realistic, it's not a wish list and we all want better transport and we all want great hospitals. It's what are the priorities. So in terms of Myrna's point, we would have very diverse older people's councils. So you would have representations from, yes, active older people who are living independently, but people with dementia, the people who are carers for people with dementia and other people with mobility issues, vision impaired, older people, younger older people, and all of those. So what we get is an eclectic mix that gives us the priorities and just doesn't fit one homogenous group. And I think for me, that's probably one of the biggest achievements. And then we have put the structures around that have enabled us to implement them. So in terms of some of the things that we've done, Myrna again was talking about transportation. We have a rural transport programme in Ireland, which is really well funded. And when it first came out, it was funded well, but it's funded even better now, because basically the importance of taking people from those remote communities and getting them to consultants appointments and in to do their shopping or to go to the post office or whatever the case is really important. So those rural transport programs are on our strategic alliances, and we actually help design their route planning. So that's an example of participation. Age-friendly towns and walking the streets and saying where it's important. So we can identify there's a vacant building. Could it become a community hub? We have memory cafes for people within the Alzheimer's Association, and all of these initiatives have been developing. And I suppose in the context of COVID, I suppose one of the biggest achievements was, and to foster, because it's one of the things you do well in Canada, is the relationship between municipalities or local government and health. And I suppose traditionally countries operate in silos. And I think what really happened through this program, we've fostered that cooperation, but particularly in COVID, each of the local authorities established a community call helpline, and they were open most of the hours during the day. They were actually 24-hour, and people could ring in and say, could you get somebody to drop me shopping out or my messages out or bring out my medication? So we had volunteers from football groups and things like that were not meeting, that were starting to call to older people, meeting them at the door. The postmen were doing it. This real altruistic community spirit where we were connecting with older people. And unfortunately, Myrna, we couldn't do the hugs, but we could drop the shopping at the door, have a conversation, see them through the window. And again, even in that context, this Wednesday, we're launching a national initiative with the Health Service Executive, where we're celebrating what we've collated in terms of a legacy document, those initiatives that worked well. Because if something worked really well, we need to learn from that. So we would have brought, these digital tablets out to older people in residential care homes who were very much cut off, so they could Skype or FaceTime their families. Now, that doesn't offset all the terrible things that happened in the pandemic and deaths, but it did give them some connection with the outside when people were being asked not to visit nursing homes. But those digital skills were given to all older people, particularly those that hadn't had the opportunity. And we actually, building on Jane's point, we have learned from that significantly. Not all older people want to become digitally connected because they want that human interaction, but it certainly helps if there is the online option. And regular information we would have sent out through the daily newsletter, succinct, in the vernacular, sent out daily to older people. This is the current guidance, but here's an opportunity for you to see all the things that you can get involved in while you're being asked to stay at home. So they're just, and conscious of time, Bianca, they're just some of the things that we learned through the program, but also in COVID, that we hope will inform what we do in the future.
Thank you, Catherine. Amazing examples. You know what? It goes to show you how even small things can have a real viral effect, big impact. So panelists, we see time and again how too much bureaucracy kills initiative. From your perspectives, what's one strategy you might recommend to others to help them bypass bureaucracy and scale up low-cost solutions that can result in big impact? Jane, what would be one strategy you would tell people to do?
Bianca, I don't think we should bypass bureaucracy. What we have to do is partner in new ways. I think this is the very problem, because we actually start creating silos ourselves. And so we have to understand the language that they listen to, just as much as we're calling on, governments to actually, and bureaucracies, to understand where we're coming from. So we must be the bridge and the agents of change rather than change the bureaucracy. So, I feel very strongly about that, particularly in the context of health. Health doesn't stand alone. Health is about the functional ability of a person. So we need to actually engage with the diabetologists and the immunologists and the public health and put them under this age-friendly umbrella. So, that's the way that we are tackling it at the International Federation on Aging.
So bureaucracy is an opportunity to engage as opposed to an obstacle.
Yes.
Myrna, how about you? How would you, advise people in terms of the opportunity of bureaucracy?
I absolutely love what Jane was saying. I think the difficulty for people with dementia, and some people our seniors often don't know which bureaucracy is where we need to go to, because there's so many levels. For a couple of years, I was involved in a committee in my town, and it had lots of doctors in it. And I was so excited. I thought, wow, we're going to get someplace. And hence, most of the people have been transferred to other hospitals, etc. And that's just kind of the way it works. So I'm not saying it's wrong, but I'm saying, how do we know who to ask, who to propose suggestions to? And that's a tough one to answer, I'm sure.
So it's not an easy thing. No. It's a complex, multi-player kind of situation that creates these kinds of layers. Catherine?
Yeah, so Bianca, I think what's really important here is what's the interpretation of bureaucracy. And I'm very much on the side of Jane, because bureaucracy can be a process. It can be a massive planning application for a housing development, or it can be somebody going in to do a form, or it can be the way community groups are set up, or it could be funding. So what is bureaucracy is the first thing. And we've capitalized on bureaucracy, because when we went back to 2008, 2009 and looking at the age-friendly program and where it would sit, because the WHO had made recommendations around municipality-led, it was hosted from the local government sector, which is a very, very well-managed sector in Ireland. And you could always think, oh, well, that's all bureaucracy. But in actually what it has done is it has enabled the process. So through the Older People's Council coming in, they can tell us where these barriers are. So we've done lots of things like made forms more simplistic and, looked at universal design guidelines in terms of that, but also in terms of a process. If somebody's coming in to get a capital fund to do renovations to their home, we're working with government around planning processes. So bureaucracy can actually be an enabler if you allow them to be a catalyst for identifying where the barriers are. So that can mean the difference between actually getting the voice heard and making that significant change that's necessary to become age-friendly.
Thank you, Catherine. Jane, Myrna, Catherine, thank you so much for today. There's so many different pieces of insights I know people will be able to take back to their own local communities. Now, you've all said to me, you have to be cranky and loud to be heard. So I want to go around the room and just ask you for one piece of advice that you would give others who are listening in today when they're working on their own age-friendly initiatives. One piece of advice that percolates to the surface for you, Jane.
It's having a simple elevator pitch that you don't move away from. And my elevator pitch is that we, across sectors and disciplines, aim to create an environment that enables an older person to do what they have reason to value. And don't, go away from that. This is what the mantra of Age Friendly is.
Don't sway from the mantra. Myrna, how about you?
I think that it's important to thank and to validate when we have successes. We all work so hard to finding successes, and I think sometimes we forget to sort of say thank you for helping us in this, and to appreciate what we've managed to accomplish.
Acknowledge the successes and build on them. Catherine, how about you?
Well, Bianca, there's an old saying in Ireland, and when you talk about having to be loud to be heard, and that is, there's a saying in Ireland which is, empty vessels make the most noise. And I think that's really important, because sometimes it's the quiet voice, the voice that rolls up the sleeves and sits down and works, that can get things done. And I'd like to just share that our Older People's Councils have been really successful, because what we said at the beginning was we wanted to hear a diverse range of voices, but we asked them to be co-designers as opposed to tokenistic older people that were coming in and saying, these are the challenges, now go on away and fix it. They're there as contributors and as partners, and they're my colleagues. It's not always about the loudest voice. It's maybe the bumblebee that's working away in the background to get things done.
Thank you. Well said. So all of you listening in today, I'm hoping that you've grabbed a number of pieces of wisdom here, and we encourage you to continue to go and develop your efforts in your own communities. The Center for Aging and Brain Health Innovation is currently working with a number of countries, including the work that Catherine is doing, to launch an international community of practice, bringing together thinking, sharing successes, brainstorming challenges, and we hope to be able to launch that in the coming months. So anybody who's interested and would like to learn more, please contact us. Thank you so much for being with us today.
Thank you.
Thank you.